Well, good afternoon, everybody. I am hoping that I am now live here on YouTube and you are able to see me and hear me. If you are watching, I'm going to talk today about Medicare Supplement rate increases. Why is my Medicare Supplement plan going up? I've been getting this question a lot, and I want to talk about it today. So if you're new to my channel, my name is Jamie from meetjamie.com. I'm a licensed insurance agent, and I help people all over the country understand how the Medicare program works, as well as connect them with the coverage that fits their needs. From everything I can tell, I am live, and there's some sort of noise coming through. I help people all over the country. Oops. All right. There you go. So this is the question I want to answer today. Why is my Medicare Supplement plan rate increasing? So as agents, we get notified when there is a rate increase for different companies. And so you may be have stumbled across this video and you're thinking, I just got notified that my Medicare Supplement rate is going up, and maybe it's going up a lot. So this is something that we've been seeing a trend, I would say, over the last year. And so first of all, let me just say, if you saw your Medicare Supplement rate increase, you are not alone. But there are some steps that you can take if that's you, and that's what I'm going to talk about it. So it's not a mistake. The feeling is probably frustrating, and those frustrations are totally valid. And so we're going to talk a little bit about that today. So one of the questions I get regularly is my plan just going to keep going up and up and up and up, my Medicare Supplement? Well, generally speaking, Medicare Supplement rates do go up regularly. And I would say it can be anywhere from 3 to 10% on average for a variety of different reasons. But there can be years like this year where maybe that rate is even higher. So the rate hikes have to do with a lot of different things. Too many to cover in this video, but I'll just give you some highlights. So as the cost of healthcare goes up, obviously the cost of insurance goes up. Depending on the company that you have, that could be dictating why that you're having that big rate increase. So it feels frustrating, especially if you're relatively healthy, because you're paying this monthly premium and you're thinking, I'm paying this monthly premium and I'm not using it very much, and the price keeps going up and up and up. So there are a lot of factors. Some of the people that I talk to, they want to figure out, rate increases in the past versus the future. In my opinion, you could spend a lot of time researching that and really not get anywhere. There are some more important things that you could look at, like the type of rating. So there's issue age, attained age, community rating. That's something that you could look at. You could look at the area that you're in. So there's a lot to consider. Let me just say, first of all, if you have a Medicare Supplement plan, and even if the rate has gone up, I have some good news for you. And I know you're thinking, well, what's the good news? Well, the good news is you have locked in and secured that coverage. So when you're thinking about this, you don't want to just think about the premium. You want to think about the value. And so there are a lot of people, and you may not know this, who would love to be able to get a Medicare Supplement, even if it meant paying the rate that you're paying. But they can't, because they can't qualify medically. I talk to those people. So the big question is there anything that you can do? Well, ironically, there is. A lot of people, they see that rate increase and they think, well, this is the way the world works. I guess I'll just be happy, and they don't do anything. Well, Medicare supplements can be shopped all year long. Let me say that again. Medicare supplements can be shopped all year long. And by the way, because this video is on YouTube and a lot of different people watch it, you may have a state where you don't have to qualify for medical underwriting. There may be special rules in your state. So it varies by state. I get some comments by that. But let me just go back to what I was saying before. You can shop the Medicare supplement plan all year long. You could apply for a new plan and keep your existing coverage until you find out that you're accepted at the new company or the plan. So you do have options. A lot of people feel stuck, or they think, well, I have to wait till the fall during the open enrollment, but not on Medicare Supplement or Medigap rates. So the key thing to remember is Medicare supplements are standardized. So for example, a Plan G is a Plan G with any company. Same Plan N is a Plan N with any company. And you would be surprised how many people, because they didn't do due diligence in the beginning shopping that rate, or they haven't done due diligence since then shopping that rate, they're paying more than they need to for the same coverage. I run across this all the time where somebody is paying more for their supplement than another carrier right in their neck of the woods, and they would easily qualify through medical underwriting and be able to get that new plan. So don't make the mistake of just thinking, well, I'm going to stay on this plan or keep this plan because it feels safer. You do have options. I have seen situations where people are paying as much as $80 a month more for the exact same coverage. So you really want to kind of buck the trend, so to speak, people who don't review these rates and see what's out there and what's available for you. So it doesn't hurt to shop. You can do it all year long. You can work with a broker like myself to make sure that you're getting the best rate. And let's say that you compare a Plan G to a Plan G, and you realize, well, there's not that much savings there. Well, if you're relatively healthy, you could look at a Plan N instead of the Plan G. So there are options. Again, I just want to reiterate, Medicare supplements are not bound by the Medicare open enrollment in the fall. You could shop it all year long. So my question is, what if you could keep your same coverage and simply pay less? Doesn't that sound like a dream come true? Well, it's possible. I mean, I help people do this all the time. I help them compare rates from different companies where they live to make sure they're not overpaying for that coverage. So now there may be more involved in the application process. Let's say you got that supplement when you were first Medicare eligible, and so you didn't have to answer any health questions. You didn't have to go through medical underwriting. This time around, you may have to do that. But again, if you're relatively healthy, this is probably something worth considering doing. So this is another reason why it's important to work with a broker. A lot of people think the word broker means you pay them. That is not how brokers work. Broker means brokers like myself, we represent the people who need insurance rather than one singular health insurance company. So Medicare insurance agents, it's free to work with us because the insurance companies compensate us for helping you, and you don't pay a different price just because you work with an agent. So I look at it this way: to shop around and to see what's out there, you have almost nothing. You don't have anything to lose other than time, right? Time and energy. And a lot of times I'll talk with someone. I talked with someone recently who was inquiring about this, just got a feel for where they were and maybe some of the health things that they'd had the last couple of years. And I was able to say, this is worth looking into. And in other situations, I've told people it's probably best to just stay put on and pay that little higher premium if you can, because maybe you now have some health issues that it's going to need to be looked at. So in reality, this is almost like shopping for car insurance or homeowner's insurance. A quick review could save you hundreds in 1 year alone in monthly premiums. And again, even if you do a little research and you decide to stay with your current plan, well, at least you know you did some work to try to put some money back in your pocket. So if you had a Medicare Supplement rate increase recently, I strongly encourage you, take a look, see what's out there. If you'd like help with that, you can reach out to me through my website, which is just meetjamie.com. I hope you enjoyed this video. If you did and you are interested, please subscribe to the channel, hit the like button, and maybe pass it along to a friend. I hope this worked well. It's a little tricky going live, but I appreciate you watching.